Hello, my name is Tia Moore, and I'm in the group with Noah, Camille, and Leslie. Okay. COVID-19 Case Study Project, Texas and Global. Brief history of COVID-19. Coronavirus disease 2019 is caused by a new coronavirus first identified in Wuhan, China in December 2019. Because this is a new virus, scientists are learning more each day. Although most people who have COVID-19 have mild symptoms, COVID-19 can also cause severe illness and even death. Coronavirus spreads between people, mainly when an infected person is in close contact with another person. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe heavily. These liquid particles are different sizes, ranging from larger respiratory droplets to smaller aerosols. Other people can catch COVID-19 when the virus gets into their mouth, nose, or eyes, which is more likely to happen when people direct or close contact less than 1 meter apart with an infected person. Global, local recent statistics. Global, there's a total of 55.6 million plus cases, total of 1.34 million deaths, and a total of 35.8 million recovered. Texas, as in local, it's a total of 1.15 million plus cases and a total of 20,872 plus deaths. And here are the deaths of each age range groups. For male is on the left side and for right is on the female side.
The preventive measures, relevant social practices, and environment are as following. To begin, the preventive measures are to help lower the risk of being exposed to COVID-19. Many businesses and stores are working at half capacity. They also require you to wear a face mask and coverings. Also, disinfect objects or surfaces that are often touched, such as your doorknobs, phones, keys, and any objects you're unfamiliar with that you may need to use. Stores now have online shopping with the option of curbside pickup, contactless pickup, and contactless delivery. While if you decide to go in-store to make a purchase, they now have markers showing you where to stand in line to maintain 6 feet away from others. And now they have more self-checkouts than they had before, but if you decide not to use a self-checkout, they now have a plastic shield to help lower the germs being passed during your whole checkout process. Many events are being held outdoors now, such as outdoor concerts and outdoor movies, which are like drive-in movies, drive-in concerts, because they're safer than indoor events, yet you still need to maintain 6 feet away from other people while wearing a face covering. If you do have to do an indoor event, make sure the room has open windows and good ventilation. The relevant social practices and environments are because you risk getting COVID-19 every time you meet someone. Experts recommend reducing your face-to-face interactions with others. So that means no in-person meetings or in-person meetups, limiting large group events. So instead of having a group of like 50 people, lower it down to like half of that. No more shaking hands, high fives, and hugs. Instead, give somebody a fist bump or elbow bump. And in place of large groups interactions, like a family function or any face-to-face interactions, use video calls instead, such as like Zoom. If you have an iPhone, then FaceTime or Google Duo. And those are all the precautions for the preventive measures, relevant social practices, and environments for COVID.
Hi, I'm Noah, and I want to go over with you diagnostic procedures and treatments regarding COVID-19, Texas edition. Namely, I want to go over the PCR test and the antigen test, both approved by the FDA. The PCR test is also known as a molecular test. This one detects genetic material of the virus using a lab technique called polymerase chain reaction. It uses fluid samples taken from the back of your throat, nose, or just a saliva sample. Results for this test are available from minutes to days, depending on certain factors. It's also important to note that it's a very accurate test when done properly. On the other hand, the antigen test detects certain proteins in the virus. It also uses samples from the back of the nose and the throat. But this test gets results faster and it is less expensive, so it is ideal for large groups of people who need to be tested. It is also important to note that this test is not as accurate as the PCR. It may result in more false negative test results. On to treatment. Now, there is no cure for COVID-19 at this moment, so the focus is supportive care, and that is to make sure the body's vital organs are normal. Patients who are positive or exposed should be isolated away from other people and animals to slow down the spread of infection. They should also be monitored to make sure there are no changes to the vital organs. If there are complications, they need to seek emergency action. There are a couple of drugs that can be used, such as cough medicine, to help with the effects of COVID-19 and provide some relief. It also should be noted that most people with COVID-19 have mild illness and can recover from home. They don't need to go to the hospital. But there are cases with people who have underlying health issues. They may need intensive care.
Past history suggests that the start of the outbreak resulted from a single point introduction in the human population around the time that the virus was first reported in humans in Wuhan, China. The analysis of the published genetics sequence further suggests that the spillover from an animal source to humans happened during the last quarter of 2019. Present COVID-19 can affect your nose, throat, lungs, and respiratory tract. It can cause an asthma attack and possibly lead to pneumonia and acute respiratory disease. The clinical presentation and chief complaints are diarrhea and digestive symptoms are the main complaint in nearly half of corona patients. Gastrointestinal disorders also is a chief complaint. Presented symptoms. People with COVID have reported a wide range of symptoms from mild symptoms to severe illnesses. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID, fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. These are not all of the symptoms, but they are many. Thank you.